Hello everyone, how are you? Thank you for watching my clinical dentistry. In this episode, I have a situation in which a young adult, his jaw was locked open. So I'm going to show you how to reposition the jaw that is in a locked open position. We have a situation here right now that we have an individual who got a jaw locked open. I want you guys to learn how to do these techniques, especially those who have never done this before. So this individual got a jaw locked open. It's like your elbow dislocated. So this is basically the jaw joint for the individual is dislocated. So I would just want you guys to take a look at this video, all right? Okay, now can you tell me what happened first? Can you talk?
Opened my mouth too wide.
This morning?
This morning, yeah. Then I got stuck.
Okay, good. Now you guys first, when you start with the patient, you put the thumbs on the molar of the patient. Put the thumbs and the back of the patient and the molar area. So I'm using this thumb as a way. Put your both thumbs back on molar here.
On the upper?
On the lower. You can come a little closer. You can come up this way so you can see better. Okay. So once you press the down, or do outside the mouth first. Once you press down, tell the person to relax the jaw. Basically on the sideways you can see better. You press the jaw down this way and move back this way. So downward and forward movement. All right. This is sideways. You can see better. Press the jaw. Support the jaw. Both fingers support the jaw joint. Press the thumb down. You push it down and pull
Slide
forward.
it up.
Yeah. Like a circular motion. Push down and forward and then shuffle it back. That's how you do that though, okay? Just relax please. Okay.
Relax, look
Just
up.
relax your jaw, keep the body relaxed. Alright, push it down a little bit. You may do a couple times. Sorry, it's so painful there. Okay, relax again.
Relax.
Relax the jaw. Okay, relax the jaw and press it down. Put the jaw forward. Do there. Okay. Relax again. All right, just relax. Push the jaw back down a little bit, and then put the jaw forward. Okay, can you close now? Okay, good. That's the basic. Now, okay, good. Now you can see the individual jaw can knock it down. So again, review that.
Oh my God.
Have the individual relax first. Both hands support the jaw joint here. Press the teeth down and the back. You have to relax it. You can push it down a little bit this way.
Like
and
all the way
pull
down
forward.
and then forward.
And then let him relax.
Relax.
That's how to help to close and open the jaw, lock jaw. Okay. Thanks for watching the video. If you like it, subscribe to the channel below.
Thank you, Dr. Su.
Thank you. We want
You're
to thank
okay
you.
now?
We want to thank Well, that completes the end of this video. I hope you will learn something from this clinical dentistry. If you like the video, please feel free to click the button below and subscribe my channel. Thank you for watching. Until then, I will see you again. May God bless you. See you next time. Bye.